Hi, I'm Dr. Bhargav Rao from Pathofast Lab in Pune, and today I'm going to tell you about the online pregnancy tests. Now, online pregnancy tests are not really pregnancy tests. These are basically just questionnaires or self quizzes that you take, wherein you fill up a form on a website. They ask you various questions about your symptoms, the timing of your last period, when you have had intercourse, when you usually ovulate, what is the normal length of your cycle, as well as all kinds of other questions that can help them estimate whether you might be pregnant. These tests have very little reliability because they don't really measure anything. They don't take any kind of sample from you of your urine or of your blood. It's just based on the answers that you provide. So one of the things that most of these quizzes will ask you is whether you feel symptoms like nausea, bloating, fatigue. What you need to remember is that these symptoms, they can be seen in thousands of different conditions. For example, you might be having a thyroid problem, which can give you all the same symptoms that you would have if you were pregnant. Also, what you need to remember is that pregnancy itself is a very complex process. A pregnancy may not be proceeding properly. You might even be pregnant, but it may not be proceeding properly. It may be developing complications, and even those complications, which can be dangerous for your health, can also give you these kind of symptoms. So over-reliance on these symptoms to diagnose or detect pregnancy is not a good idea. These quizzes are useful, but they cannot be relied upon. So here are some things that these tests cannot do. Number one, they cannot tell you with any degree of confidence whether you're pregnant or you're not pregnant. Number two, they do not measure the level of HCG, which is called human chorionic gonadotropin, also known as the pregnancy hormone. They don't measure the level of this hormone, and actually that's the only way to tell whether you're really pregnant. Number three, they do not perform any kind of scan on you, like an ultrasound scan, because an ultrasound scan is the best way to know and confirm whether an elevated beta HCG level is actually because of a pregnancy. So these tests don't do any of this. It's just an online form that you fill. Please take it with a pinch of salt. So what is the actual use of these online pregnancy tests? They were initially designed to actually help people who are in low resource settings. For example, in very poor countries, women who didn't even have access to simple home pregnancy test kits. It's the kind of thing that can be administered by a healthcare worker with nothing but a pen and a paper in their hand. It's a list of questions that they can ask people in very poor countries and try to decide whether they are pregnant or not. The real value of these things is basically to help you decide whether you should go ahead and do further testing. A simple example is that if you take one of these online pregnancy tests and it gives you a result saying that you might be pregnant, well, then that could be a very good reason for you to go to a doctor, to a laboratory, and actually get yourself tested. So if you feel that you might be pregnant and the online quiz also tells you that you could be pregnant, definitely go ahead and get yourself properly tested, go to a doctor, get a proper clinical opinion. But if the online pregnancy test indicates that you're not pregnant, that doesn't mean anything. You might be pregnant, you may not be showing any symptoms, you may not have answered the quiz properly. There can be n number of reasons because of which it could tell you that you're not pregnant. It doesn't mean that you're not pregnant. What is important to remember is a doctor's opinion, a laboratory test, and clear medical advice is the only way to really know whether you're pregnant or not. Yes, these online quizzes are useful, but in certain situations only. What are the dangers of these online pregnancy tests? I mean, where can it go horribly wrong? There are certain types of pregnancies which are abnormal, complicated pregnancies, which we call ectopic pregnancies, where the pregnancy takes place in an abnormal part of your reproductive tract. Chemical pregnancies, where beta HCG levels rise but the embryo is not viable. N number of such situations can arise, which will be completely missed by these online quizzes because they don't really know anything about your body. And so they can be really very dangerous. As I said, if it indicates that you could be pregnant, go ahead and get a medical opinion. If it indicates that you're not pregnant, don't rely on it. You should go and seek medical advice if there's even the slightest doubt that you personally feel that you could be pregnant or that something is wrong with you.